So the data elements of all of that is really important, because if you're never seen in a healthcare organization, you can't have the data that's then captured. And, starting back, 20, 25 years ago, Dr. Collins, you're here with us today. You think about the sequencing of the Human Genome Project. You think about all of our genomics research and all of the data that we have stored. Where are those patient populations? How many patient populations do we really have of the African American population? How many do we have of some of our diseases that we just haven't been seen in, except in our biggest medical centers, and except in our biggest areas? And how much data sharing are we actually sharing? And so as you're thinking about this from an investor perspective and a policy perspective, how is the data component of all of this helping us with cures or not helping us with cures? Talk to us a little bit about that.
It's a great question. I don't think you meant to set me up or set me off, but because what Matt said is just so important. It's actually hard to hear that people don't care about sickle cell. I'm old enough to have grown up with several kids who died. I mean, if you're in your 30s with sickle cell, you're one of the lucky ones. Because when I was younger, in elementary school in Nigeria, most of the kids that had sickle cell died by the time we hit 5th grade. So it's very real. And by the time a child dies at that age, or you're a teenager or an adult, there's a trauma that family has faced, often because when they do interact with the healthcare system, it's almost abusive. You're not believed if you're older and you're able to speak for yourself. There's a certain amount of dismissiveness, I think, that you experience, and that complicates things. So there's this challenge, I think, with a lot of scientists, or my colleagues in the science world, understanding that what gets cured and who gets cured is a political discussion. And it's not just a question of do we have the technology or do we have the data. So just wanted to sort of put that on the table. In terms of data, I mean, I think we have there's quite an evolution in data. We've got companies like Evidation that I advise, taking us in a very sort of advanced way of collecting real world, ongoing 24 hours a day monitoring of how you are responding to various therapies or not, that I think can help inform what we really call precision medicine. You've mentioned Dr. Collins, who is here, and I worked with when I was in the administration, the Obama administration, should be clear about that, around precision, when we were putting out, launching the precision medicine initiative. It is one thing, however, to collect data. It's one thing to collect and store, and let's say you figured out our quintessential questions around data security and privacy. What do you do with it? What do you do with it? Who gets access to that data? And so I always want to bring this back to health systems, the physicians that are supposed to help patients navigate a very complex world. Who gets access to, who is informed even about different clinical trials? Who is informed about new therapies that might be coming on the horizon for which they may be qualified, or their condition might be indicated for? Again, very challenging. And we don't have a health system in the country, right? So in some ways, it's like you need a huge stroke of luck to be informed about something, which it shouldn't be, because we have the infrastructure, right? To collect data, to store, to hopefully help direct people in the right, through the right care pathways, even if some of them are experimental. But it's just not systematic,
right,
the way we do it. So I think, we've got this sort of political question that we raised. We've got data, lots of which we have and are collecting. They don't often talk to each other, and it's, we don't have a systematic way of, using that information that you glean from the data to make clinical decisions and care decisions.
And it's a clear miss, right? Because at the end of the day, another thing that we've seen about data is it's pocketed by therapeutic area usually.
Yeah.
And we're doing a little bit better. You know, think about what Singapore is doing in genomics specifically for cancer. You think of certain pockets of the world, certain regions of the world that can do it a little bit. It's one region, one patient population, and still not enough for that full continuum for, again, for the cure.
For the cure.
Yeah.